This is an informative video of the skull sutures and the bones surrounding them. The skull has a total of 22 bones, 4 of which will be covered in this video. The 4 bones covered are the frontal, parietal, temporal, and the occipital. These 4 bones are flat bones and are known as synarthrosis. Synarthrosis are immovable, interlocking joints. Sutures surround the bones and have an irregular sawtooth appearance. They differ in shape, size, location, and not everyone has them. Sutures, which are like seams, are located between bones. They are held together by a small amount of fibrous tissue that is tightly bound. The fibrous tissue is continuous with the periosteum around the bones. Periosteum is the dense fibrous membrane covering the external surface of the skeletal bones. The exceptions are joints, which may be used as an attachment for muscles and tendons. The 4 sutures that will be shown in this video are the sagittal, coronal, squamous, and the limboid suture. The sagittal suture is located on the midline or the sagittal plane of the skull and lies between the 2 parietal bones. The coronal suture is located between the frontal and parietal bones. This suture is on top of your skull, running horizontally. The squamous suture is located on the lateral side of the skull between the temporal and parietal bones on both sides. The limboid suture is located between the occipital and parietal bones on the posterior side of the skull. The suture of the skull allows the bones to move during childbirth. They act as expansion joints that allow the skull to expand as the brain and bones grow. If the sutures fuse prematurely, it will not allow growth in those areas, which can cause an abnormal shaped head. When babies are born, they have soft spots on their skull called fontanelles. Fontanelles and sutures allow infants' brains and bones to grow, as well as allow the bones to overlap during childbirth without causing any damage to the brain. Fontanelles are the space between the bones and the sutures that have not yet formed together. The biggest fontanelle is located on the anterior part of the skull, where the frontal and parietal bones meet. The anterior fontanelle is also located where the coronal and sagittal suture would meet. The second biggest fontanelle is on the posterior side of the skull and is located between the occipital and parietal bones. The posterior fontanelle is located in the middle of the limboid suture. The smallest of them all is located between the temporal and parietal bones on each side. The posterior fontanelle closes between 1 to 2 months old, and the anterior fontanelle closes between 9 months to 18 months old. Doctors use the sutures and fontanelles to see the progress of brain development during infancy. Any bulges located on the skull suggest that there may be too much pressure and needs immediate attention. At birth, the brain is only 25% of an adult's brain size. Sutures allow the brain to expand 3 times its original size and play a huge role in bone development. Once children are between the age of 2 and 3, the skull bones begin to grow together, but will not fully fuse until adulthood. Once the bones have formed together in adulthood, some sutures serve as areas of shock and absorption, while others will ossify. In conclusion, the sutures allow the skull to do amazing things, from childbirth to expansion of the brain and bones. The sutures give our brain the flexibility to expand and the ability to change over time. This video was filmed for Human Anatomy at Saddleback College.